guys, I'm TJ, this is Cody. We're from the Oklahoma HTC and we're going to do a video today on self-infusion. We're going to do one as a person infusing another person and then an actual just self-infusion. So over here on our tray, we have all the supplies needed for an infusion. We have a self-infusion tourniquet, we have alcohol pads, Band-Aid, cotton ball, factor, this is just saline for this purpose, and normal saline. Some people do like normal saline, some people don't. It's whatever your preference is and whatever is best for you. And we have a 25 gauge needle. So we already have all of our supplies here. We've already washed our hands. We've already cleaned our surface where we're going to do our infusion. So we're just going to bring our tray over here, and we are going to do an infusion on Cody. So on the self-infusion tourniquets, they're kind of like a seat belt. You just put it in and then you pull this, and then to release you just push the button. There's multiple different ones. You'll just have to find the one that's best for you. So you'll put the tourniquet on. You can have the patient put their arm down, pump their hand. You can kind of even give a little tap to try to feel it. The vein should feel bouncy and not hard. If you're feeling like a hard tight, that's more than likely a tendon or ligament. The vein should be bouncy. If you see here, Cody has a really good blue line, and that's where we're going to go today to do our infusion. So like I said, some people like to prime their needle with the factor. Some people like to prime it with saline. So it's whatever your preference is. I am going to prime it with factor just because that's my preference. So I will just prime it up to the needle. So then I'm gonna clean the area with alcohol and try to just keep the arm straight. You'll need to take the cap off of the needle. If you notice, there is a little bevel. You want to make sure that the bevel is up towards the sky. So you'll feel the vein. You can kind of pull the skin tight, and then you'll go in about a 30-degree angle at this one. Depending on where you go will kind of depend on your angle. You'll go. You get a little bit of flashback. Once you get that flashback, you'll pop the tourniquet. You can pull back to make sure you have blood return, that you're in the vein, and then you'll slowly push the factor. And you want to just push as the vein tolerates. You don't want to go too fast because you can blow the vein. So you'll just push the factor all the way till it's completed. Once you are done, you want to get a cotton ball. You want to hold good pressure, take the needle out, put it in a sharps container. Make sure you hold for 5 minutes, apply a Band-Aid. After you are finished with your infusion, then you want to make sure you log your treatment. That is for one person infusing another one. Our next video will just be a self-infusion.